My name is Mark Demansky, Senior Physiotherapist at MD Health. I'm going to talk to you today about the most common reason for elbow pain, that's tennis elbow. So we do see quite a lot of this stuff. We see people coming in with pain in their elbow. The most common reason is a breakdown of the muscle here on the side of the arm called the ECRB, or extensor carpi realis brevis. It starts at the tip of the elbow and it goes down and inserts into the wrist. Its major role is to hold the wrist up when you're using it. So when you're typing on the computer, it's called tennis elbow because it's originally, if you've got a weak shoulder when you're hitting a tennis ball with a racket, you flick your wrist more, and so this muscle has to work harder and it breaks down. But the most common reason we see these days is typing on the computer. So if you can't keep your shoulders back and up, you hold the wrist down and it puts that muscle on stretch and eventually starts to break down because it can't take the load. What we're going to do today is talk about what you can do to make the muscles stronger. We start, just like with hip exercises, what's called isometric exercises. So holding it still so the muscle contracts, but he's not putting on that excessive load, so it slowly starts to heal. We're going to do this with a 1 kilo weight, really light, but really important. We're going to have the arm over the edge of a bench. I'm having an edge of a reformer this time. And I'm going to lift it up and hold it still. We're going to hold it for 10 seconds. And the aim of this one is when you hold it for 10 seconds, there shouldn't be any pain, or at least no more than a 2 out of 10 pain in this elbow, and then letting it go. So that was 10 seconds. Now we're going to do it again, holding it there, and you shouldn't feel any pain in this area. And the aim is to make this muscle stronger without putting too much load on it. Good. So I did 2 repetitions of that one. Normally we want to see about 10 repetitions of that exercise. We do it, you need to see that exercise being done for about 2 weeks pain-free, or no more than a 2 out of 10 on the day, and no more than a 5 out of 10 the next day after the exercises. Because if it hurts more than that, the load is too high, we have to back it off, reduce the weight, reduce the number of repetitions. Otherwise, it's your tendon telling you, I'm not able to take this load, I'm breaking down, it's not working for me. The second thing we do after working on muscles is that we can actually release those muscles and do some specific massage techniques. Putting your fingers on where it hurts, then allowing you to drop the wrist down. Now, it feels quite uncomfortable when you do this, but as you do it more, it should become easier and lighter to do in the wrist area. So you should feel less and less pain. We're going to start by putting pressure exactly where it hurts. It doesn't matter if your anatomy isn't perfect. If you press on where it hurts, it works. Pushing it down, and back up, pushing it down and back up. As I'm doing a few more repetitions of this one, it starts uncomfortable, but I can feel less and less of it the more I'm doing, and the further my wrist can go. So the 2 in combination work brilliantly to help actually affect and improve this kind of pain. So we start by making it stronger with the isometric exercises, holding it still, and then we do the massage or myofascial release techniques to help reduce the muscle pain in the area. And that's where I'd start with tennis elbow.